Well, good afternoon, everybody, and welcome. Thank you very much for coming. This is for AIDS Vancouver. This is AIDS Vancouver's Red Ribbon Month, and I'm very glad to be here. My name is Tasha Riley. I'm the Prevention Education Coordinator over at AIDS Vancouver. This lecture is called Labels Are for Cans, HIV, AIDS, Stigma and Discrimination. The issue of stigma and discrimination, I wanted to kind of talk about it by beginning with a little bit of a story. One of the things that I used to do was I used to work as an educator teaching HIV/AIDS issues to local teachers in Botswana and Africa so that they could go around in their own villages and teach people about HIV/AIDS related issues. I had an experience once there where one of the local teachers that I worked with, her name was Edith, ended up alerting me to the fact that at one of the houses where she went to, there was a young girl, not more than 5, who was HIV positive. Both of her parents died because they were both HIV positive and they had died of AIDS-related diseases. And this little girl had been taken into care by, I believe it was her aunt and uncle. Anyway, due to a lot of the fear and misunderstanding around HIV/AIDS, this young girl was basically isolated from the rest of the family. She was given separate utensils. She had her own clothes that she wasn't allowed to share with anybody else. She wasn't allowed to eat at the same dinner table. She had to eat outside. And this is a girl who's only 5. And it was something that was really tragic to see. Edith ended up having to alert the social worker, and then the young girl ended up having to be taken away because of some of the mistreatment that she felt. Now, I bring this up not to say that this is something that just happens in Botswana, because most of the families there that I met were very, very caring and very, very considerate. However, the misunderstanding around HIV/AIDS is something that happens there. It also happens here. I've been to recovery centers where I've had people who have come up and said that they're HIV positive and said that some of the people that they live with are still afraid to share cups and utensils, which again, you cannot catch HIV from sharing cups or utensils or sharing a cigarette with somebody. I've been to colleges and universities and talked to healthcare workers as well who were still uncertain about working with somebody who had HIV for fear that they might catch it themselves. So there's still a lot of misinformation around HIV. So just to tell you a little bit about stigma, so Irving Goffman in 1963 wrote a book called Stigma, Notes on the Management of a Spoiled Identity, and basically describes stigma as an attribute that is deeply discrediting within a particular social interaction. The term originated from Greece, and it was meant to refer to a tattoo or mark branded on the skin that identified the person as someone to be avoided. And stigma can relate to many different things. Sometimes stigma can be an illness or sickness can be stigmatized. A person's race or ethnicity can be stigmatized. A person's sexuality can be stigmatized. All of this has to do with the way society thinks about something in particular. So what HIV stigma is when somebody ends up stigmatizing an individual because of their HIV status. And basically, people that are perceived to have HIV/AIDS are ended up being isolated or marginalized in some certain way. But some of the main reasons why people end up getting stigmatized is, one, HIV causes a lot of fear. It is a life-threatening disease, and people get scared. And when people get scared, they're less likely to talk about things. Also, HIV is sometimes associated with other behaviors that have also been stigmatized, such as homosexuality, drug addiction, and sex. Most people contract HIV through sex. This already contains a lot of moral baggage. People are afraid to talk about sex. Sex is intimate. People don't like to talk about it, so it becomes a little bit hush-hush. There's also a lot of misconceptions around the way HIV is spread. People don't understand how HIV is spread, and so then, again, it can lead to more stereotypes, more stigma around that. And HIV is often thought to be the result of personal responsibility. as well. So there's a lot of blame that ends up being put on an individual who is living with HIV, which is quite unfair. When you think about people who have cancer or something like that, the same sort of blame isn't placed on somebody who gets cancer that is put on somebody who has HIV. But discrimination can lead to things like the loss of health care services for somebody, not getting the kind of treatment of care that they should have or deserve. It might mean the loss of livelihood. Some people have been denied working positions or have been fired from working positions because of their HIV status. In some cases, it might mean that somebody who's living with HIV isn't able to go and visit a certain country. And this was the case in the US until very, very recently. So there's been some research that talks about the various effects of stigma, and some of these things aren't going to be that surprising for you. So people living with HIV/AIDS often experience stigma. We know that. Stigma can make it difficult to get HIV tests, or because people are afraid, because they don't want to be stigmatized, they might be afraid to learn what their status is. A lot of people feel very apprehensive about getting a test for HIV because they're afraid of what that might mean if they do end up having HIV. And this, of course, has an impact on whether or not the person takes treatment or is able to receive better care for themselves. There have been some studies that have shown that men and women experience stigma differently. There needs to be more that explore this. It's hard to measure stigma. This is a really big challenge in that it is hard for us to gauge how much stigma impacts a person. So more studies need to be designed that basically capture what are the impacts of stigma on a particular person. How much does it inhibit them from going to get testing, from going to get treatment, from going to get additional care? These are all things that need to be further explored. One way to address stigma is to work together. So for different organizations around the world to kind of talk about the different kinds of initiatives. While some programs address stigma, we need better forms of evaluating the effectiveness of the programs. So again, this goes back to this, and that it is hard to measure stigma. So how we evaluate that is something that needs to be looked at further. We do have some studies that are out, and these are the results of one of the more recent studies. This was from the AIDS Treatment for Life International Survey, also called ATLAS. And so this was in 2010, and basically this was a telephone survey that was done across 12 different countries. You see the countries up here. And perhaps one of the most significant findings of this study was they only looked at one country in North America, and that was the US. And there they found that 42% of the people, it was 2,035 people living with HIV/AIDS who were talked to, and they found that 42% of the people living in the States that were interviewed had answered yes to "I feel alone and isolated because I have HIV/AIDS." And this was significantly higher than what they had found in the countries that they had interviewed in Africa, where it was 24%. So it's interesting there when we talk about stigma and discrimination, how just with our neighbors, the percentage of people who feel alone and isolated is so high, almost half. The other thing that was very significant about that particular survey is that 22% of the people interviewed in the US indicated that there was no one that they could turn to look after them. So again, really illustrating how alone people feel and how limited sometimes people feel in terms of reaching out and finding that care. And a lot of this has to do with the stigma. And here you can see some other findings of that particular survey. Now you might be curious about what's happening in Canada. So I was looking around for different kinds of studies in Canada, and the most recent study that I could find was one by Ecos Research Associates. And this was talking about people's attitudes towards people living with HIV and answering a number of different questions to get people's responses. And this was in 2003. And so in this one, there's a number of different questions where people have to basically rate whether they feel very uncomfortable, somewhat uncomfortable, somewhat uncomfortable, somewhat comfortable, and somewhat uncomfortable, and very comfortable. And as you can see, as things get a little bit more personal for people, people still begin to feel more uncomfortable. So as soon as the question, your child was attending school where one of the students was known to have HIV/AIDS, this very comfortable number gets a lot smaller. Even smaller still when the question becomes a close friend or relative is dating someone with AIDS, or a close friend or relative is dating someone with HIV/AIDS. The comfort level goes down even more. So while if you work in an office, the comfort level's a little bit higher. As it gets closer and closer to the person experiencing it, the comfort level goes down quite a lot further. Another interesting finding of this particular study is the extent to which you agree or disagree with the following statements. One of the things I found interesting here looking at this study is in this one it says, people who have HIV/AIDS should be allowed to serve the public in positions like hairstylists. So 67% agree that this is okay, 18% disagree. Look at how much the number changes when the question is, people who have HIV/AIDS should be allowed to serve the public in positions like dentists and cooks. All of a sudden, you have a larger range of the population who's disagreeing with these statements. Even though you cannot get HIV from serving or cooking food, also, dentists and doctors in Canada are supposed to use universal precautions, which means that they're supposed to treat everybody as if they have HIV/AIDS and are supposed to act like they themselves have HIV/AIDS. And yet, still, we're seeing people who are very edgy about having people work in particular professions. So again, this is another way that stigma gets perpetuated. So I'm going to talk a little bit about the various kinds of stigma that we see. So one kind of stigma that we see is secondary stigma. And what secondary stigma is it's basically stigma by association. So somebody might be living with HIV, and yet even their family or friends might be affected by the stigma or discrimination that that particular person receives. And one of the most widely known cases of this happening was a case of Ryan White. This was, again, in the States. It was in the 80s. Ryan White had hemophilia, and he ended up contracting HIV through a blood transfusion. And when it came out about his status, both him and his family were taunted by neighbors. They were ostracized by the community. And as you can see here, that there were 117 parents and 50 teachers who signed a petition to ban White from attending school. And again, it's easy to think, okay, this is something that maybe happened in the States. Would it happen in Canada? But one thing that I would encourage you to take a look at is in the CBC archives, you can actually see a documentary where there are parents, and again, this was in the 80s, where there were parents who were basically debating with doctors on whether or not children who are living with HIV should be allowed to go to school. So again, this was a debate that was also happening here in Canada as well, because parents were apprehensive, again thinking, oh no, maybe my child will catch HIV, even though there's only very, very specific ways that HIV can be contracted. Another kind of stigma is physical stigma, and this is a little bit, this parallels the story that I was telling you about in my own experience in Botswana, of somebody being isolated, shunned, or abandoned. And in the same study that I was reading, that international study, they found that 65% of respondents reported that disclosing their status to family members was the most difficult thing. Just for fear that the family or close friends might end up rejecting them because of their status, or making assumptions about lifestyle, or questioning different kinds of things around that. Other forms of stigma that we see is social stigma. So again, being isolated from the community. Also, loss of respect, status, and dignity, and also voyeurism. And this has been an interesting one, particularly with regards to where I work at AIDS Vancouver, where we have had situations, most of the volunteers we have are really incredibly wonderful people. Occasionally, though, we do get phone calls where people will end up wanting to volunteer just to see somebody living with HIV/AIDS. as almost sort of an experiment or a morbid kind of curiosity that doesn't have to do with caring, but more has to do with voyeurism. And so again, that's the kind of thing that we want to avoid. We want to have more education and have more people understanding what's going on and more respect for human beings, but also want to get away from this sort of voyeurism that isn't attached to a more natural, caring feeling. So again, 79% of the respondents of that international survey I was talking about were concerned about others learning their HIV positive status because they were afraid of how people would act towards them. And then we have verbal stigma. This is pretty apparent. So verbal stigma is when somebody is given a name, maybe because of their HIV status. There have been certain things like walking death or walking skeleton that have been used in different countries as a way to describe somebody who's living with HIV. Also, verbal discrimination can take form in these kinds of ways, where somebody who's living with HIV has a negative reaction from somebody in terms of, wanting to have a hug or touch or anything like that, any sort of physical contact. People can be afraid. An institutional stigma, so again, you saw a little bit of that in the one video, and this is when people are denied jobs, scholarships, and visas. This stamp you see is actually, it's from the Red Cross, and it was for a campaign to stamp out stigma, and they had a number of different stamps like this to basically, again, spread the word that HIV, you cannot get HIV in certain circumstances. 36% of respondents said that they were afraid that if people knew their status, they would lose their job. And I have heard about people losing their jobs in Canada because of their HIV status, particularly if they worked in a health profession where people hadn't understood what was going on. That HIV is contracted only when we're looking at things like unprotected sex, shared needle use, blood transfusions, although now with blood transfusions we have screening, so there's only about a 1% chance of that, and then birth or through breast milk, breastfeeding. So again, just kind of trying to emphasize the fact that you only can actually catch HIV in certain ways, and it's also our responsibility to be knowledgeable around that. I wanted to show you how HIV and how living with HIV can also intersect with other different kinds of things that can also be stigmatized, or other populations that have been marginalized, and how all of this working together can have a negative impact on somebody. This is from a recent study called, 2003, A New Look at Homophobia and Heterosexism in Canada. And this says, AIDS was the phenomenon in which all of these fears and taboos intersected. It will end up having an enormous effect on the way that gays and lesbians imagine themselves, define themselves, and struggled for a place in society. And in this research report, it talks about the impact HIV has had on these specific communities. As probably all of you are well aware, that in North America, HIV got very much stereotyped as being a gay disease, which of course it's not. Anybody can be infected with HIV. And one of the things that was really interesting for me when I went to Botswana and I was working with the educators there, when I had asked who can get HIV, all of the teachers that I worked with, there was only one of the teachers, and all of the 50 teachers I worked with put up their hand and thought that somebody who was gay could get HIV, because there the stereotype was that only such heterosexual people could get HIV. So it's interesting to see how different stereotypes, how different kinds of stigma, how different kinds of myths can change depending on where we live. So at the time when HIV came out, there was also a lot of gay and lesbian activism which was taking place at the time. HIV coming out meant that there was a little bit of a disruption in that more attention then was going on towards HIV, because of course it was immediate. People were dying, and so the focus ended up being brought here. The result of this ended up being an eradication of the attention to some of the lesbian community and its health issues, even though the lesbian community was also very involved in the care for people living with HIV. And another impact, and this is again how different kinds of stigma regarding different kinds of communities can actually counteract each other. So here, what ended up happening was that AIDS service organizations serving the needs of the whole community ended up silencing gay and lesbian issues, often at the demands of funders and public and private, because of the fear that, okay, well, if the AIDS Service Organization was too associated with gay and lesbian communities, they wouldn't get the funding, which is, of course, really sad when you consider that gay and lesbian communities were very, very active in making sure that people were actually aware of HIV and making sure that treatment and proper care was happening. So again, you see how these different kinds of stigma can work against each other. So what are the impacts and influences of stigma on an individual? It can mean the further deterioration of physical health if people are afraid to go and get care. Loss of job securities and stabilities. Can cause stress if you feel that you're being stigmatized by your community and friends and family. That can cause more stress, which again has a negative impact on physical health. In very extreme situations, it can cause suicidal tendencies. Mental health issues like anxiety and depression, guilt. There can be an enormous amount of guilt, both towards oneself and for loved ones if they feel that their loved ones are being also put through some of that secondary stigma we were talking about. There can be loss of support with personal relationship and also emotional and physical violence. That if there's two people and if one person feels more vulnerable, or if they don't have if they don't feel like they have a certain amount of power in that relationship, it can be very difficult for them to reveal their HIV status because they might fear that they're going to be abused physically. So what are the impacts on a community? It can allow people to deny their own risk. So the idea that, oh, well, HIV doesn't happen to me or just the people I know. That happens to other people or those people over there. So again, that bringing that denial of responsibility. It can also interfere with people's ability to speak openly about things like safer sex and condom use and how do we negotiate that. I talked about people fearing to get tested, and this is a huge one. I know from giving workshops all around Vancouver, this is one of the biggest things. People are often afraid to get tested, and the main reason people tell me about their fear of getting tested is because they are afraid other people will find out their status, and then they're afraid of how people will react to them. So that's how much stigma is an impact there. People will avoid known HIV testing sites. And we actually see this a little bit at AIDS Vancouver, where there are some people that are afraid to go to AIDS Vancouver because they know that people know of it as AIDS Vancouver, and they're afraid that if they go into the building, people will think that they're HIV positive. It discourages people from disclosing a positive test result, so they won't end up getting treatment or the support that they need. And again, as I mentioned before, it might end up leading people to be afraid to disclose their status because of the fear that they might end up suffering from violence or physical abuse. These are some initiatives from Canadian HIV/AIDS Legal Network. These are ideas of how to reduce HIV/AIDS related stigma and discrimination. And they have about 18 here, and I have maybe about 8 that are up here. So I, again, strongly recommend you take a look at this. Some of the things that they mention is the participation of people living with HIV/AIDS in actions against stigma and discrimination. It's something that's called MIPA or GIPA, so meaningful involvement of people living with HIV/AIDS. Affordable, accessible, and adequate housing, and we can't emphasize that enough in Vancouver, how important and necessary that is for people living with HIV. Participatory and inclusive research. And so what this means is research projects that actually involve the community, that are coming from community organizations, and that are coming from people who are living with or affected by HIV/AIDS, because these are going to be the people that know the issues the most. Informing media coverage. And here I just wanted to give you an example of the different kinds of media coverage that has happened over the years. This was when HIV was first sort of recognized, coming out in the early 80s. And as you can see, it's very factual, it's very informative, kind of a little bit like those H1N1 posters we were seeing last year. Then we start seeing posters that are relating specifically to certain communities. So an example of one of the posters there, these bars will not protect you from AIDS. Now we're starting to see the certain myths that are coming up around HIV and AIDS. We have media that's trying to get people's attention to kind of eradicate those myths. So can you get AIDS from a toilet seat? No, but there's help numbers to talk to people about what some of those myths are. Posters that are talking about no one is immune. So this is going into late 80s, this idea that anybody can be affected or impacted by HIV/AIDS. More emphasis on condoms. We actually have this poster at AIDS Vancouver. Condom Man says, "Don't be shame, be game." So the emphasis of safer sex. HIV posters that are being directed for specific communities, again, we see being highlighted. So he'd tell me if he's negative, he'd tell me if he's positive. We also saw, particularly in the late 80s, some more advertising, kind of fear-based campaigns. So do you have a death wish? Tried to get away from this a little bit more now, but this was a popular kind of advertisement that was happening then. And to continue on with some of the legal network's other initiatives that they are advocating. So protecting people living with HIV and employment, so through policies and legal frameworks. Education for youth that is accurate, appropriate to their age and not judgmental. So something that does advocate a number of different avenues and that actually speaks specifically to stigma and discrimination. Fair treatment for immigrants and refugees. And a greater awareness of human rights in general. And the focus, the necessary focus on human rights is, again, basically to just really emphasize the fact that we're all human and that regardless of what a person is living with or what a person does, they should be able to be treated with the respect and dignity that they deserve. So what can we do? Educate yourself and others, knowing the basics of HIV/AIDS, going around and talking to people about that. Again, the more that we talk about it, the less people are afraid and the less misinformation that gets spread. Promote community development and community involvement, so volunteering. Initiate or support actions to advance or strengthen prevention messaging. So if you have any good ideas, talking to community groups about how you can get those promoted. Remain mindful of issues related to HIV-related stigma and social isolation. Again, another thing that's very important. And again, also writing to people, writing to MPs, writing to politicians to advocate for things like human rights. And so more information on some of these organizations that I've talked about are here. And I also encourage, I see some of you have been taking down notes, to check out some of the other ones that I've emphasized in this particular discussion. Spread the word, the education, but most of all, spread the love. Thank you. Thank you.